A quick fix for bladder leaks. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. I want to talk about this little product here called the Revive, something you can buy over the counter. I got this off Amazon and this is just my demo model. I'm going to show you this. It can be a really great way for that quick fix for bladder leaks. However, I do want to stress in this video that it doesn't replace, say, strengthening. It's not going to do anything long term, but it can really give you some reassurance. If you are experiencing incontinence or leaking of your bladder and you want some reassurance when you're going to the gym, maybe with sitting in a meeting or a conference or going to church, maybe on an airplane where you feel like, you know what, I just want to make sure that I'm not going to leak through my clothing if I cough or sneeze or laugh too hard. And maybe you're somebody right now that currently relies on panty liners in order to have a little reassurance. And so I want to give you a little tour, so to speak, of this product to see if this is something that could help you as well. All right, let's get started. I'm just going to take this out of the box and show you what is inside and also give you a little demonstration of it. There are some instructions in here as well, but comes in this little travel packaging, I guess. And this Revive comes with a 1 month supply. So you would, I'll kind of show you this and then it'll make more sense, but it comes with a 31-day supply of strings. And this is what the device looks like itself. Okay, so it's silicone, it's very flexible, and this would go up into the vaginal canal in order to help stop bladder leaking. And I'll go over all of this, but this is what it looks like. It comes with these strings, and basically you thread the string on here, okay, onto this little silicone device. So this is going to be much like, say, a tampon string, so that you, when it's inside, you have this hanging out, so that way you can pull on it to remove the device. Okay, so once that's there, then you can use the applicator here, and it looks a lot like a tampon applicator. So you just take this and you open it up. You take the blue part and you take the silicone device and you just fold it a little bit so you can actually insert this into here. Okay, and then the string here, you're going to thread it through this white part, and this goes in like that. So you have the string here, and then you get this to the end. Okay, then this would be like a vaginal opening. Okay, so you would insert into the vagina, and then you would push this end. And so what's going to happen is this is going to stay inside and this is going to be outside of the body. Okay, so again, I'm going to go over kind of how this works, but this really is meant for stress urinary incontinence, meaning if you experience leaking of your bladder when you cough, sneeze, laugh, run, jump, where you have that sudden increase in pressure and your bladder is just getting maybe a little squeezed and it's letting a little bit of urine out, that this product is appropriate for that. It is not, however, used for your urge incontinence, meaning if you have the type of incontinence or leaking that you feel a sudden urge to have to go to the bathroom and you need to rush to the bathroom to get there, it's not going to help with that type of incontinence. The other thing I want to say, if you have a prolapse, this product may not work for you. So I'm going to show you just a little anatomy and how this device works. So here I'm looking at a female pelvis. So you can see as we're looking down in here, we have the bladder, the uterus, and the rectum. Those are the organs within this pelvic space. I'm going to take out just these two organs, the bladder from the front and the uterus here from the back. So this device goes into the vaginal canal, right? So it's going to go up in through here, and it's going to go into the space between the cervix, which is the opening to the uterus. If you have not had a hysterectomy, you would have that. And then the bladder here. So you can see here, hopefully, that this little flap here creates a little bit of like a valve or a stop to the urethra, which is basically the exit from the bladder to the outside of the body. Okay, so we're holding urine here in the bladder, and this is just going to create a little bit of a sort of a valve or like a kink, so to speak, into that urethra, which is going to I wouldn't say that it completely stops the flow of urine by any means, but it's going to help with those leaks. This device, I do want to go ahead and say that you can still pee and poop with this in. You would not want to have sexual intercourse. And like I said, if you have a prolapse, this device might not help you, because a prolapse is basically just means that one or more of these organs are not in their expected position, and they're coming down a little bit. And so with a prolapse, this device, one, might not stay in the place that it needs to, and it just might not be efficient. So I want to go ahead and say that. I want to say that on the side here are some reasons not to use this product. I won't go into all of that, but you can read the product packaging to see if this is an appropriate device for you. Where can you get this? Well, I'm kind of an Amazon girl, so I just went ahead and went to Amazon and ordered it. It cost me about $20 to get this demo. And I'm sure you can probably find it other places, maybe Walmart, maybe Walgreens, but I don't know. Just search around a little bit, but I do know you can get this on Amazon. The last thing I want to say is this can be a great kind of quick fix thing to, again, give you some reassurance. However, I want to stress that to really fix incontinence and to find out why it's happening with you and how to actually make long-term changes, pelvic floor physical therapy really is your best bet. Because although I do recommend this at times to my patients, they're using it in combination with the care and the education that I'm providing as a pelvic floor physical therapist. So if you're out there right now and you're hoping, this is going to solve your problem and that this is going to be the end all be all, maybe it works for you like that, and that you're willing to spend, $20 every single month for this product, and that you don't mind wearing this product all the time. However, for a long-term solution, I recommend seek out pelvic floor physical therapy. You can always reach out here to us at the Healing Spot Physical Therapy. Head to our website, healingspotpt.com. Pick out whatever option works out the best for you. Let's sit down for a discovery session and get all of your questions answered and come up with a customized plan to help you feel more confident, have less leaking, and enjoy your life. Thanks for watching this Ed Talk. I will see you on the next one.